On this episode of Bondi Vet,
Oh, poor guy.
Audrey's brave little patient faces a setback.
We're going to have to hope that we can get on top of that infection because this guy's been through so much already.
He's a good boy.
Chris makes a devastating discovery in a little rescue dog.
This is an issue that could kill Benji any day.
So, pretty bad then?
Yep.
Can the team at SASH find a way to save him? Scott's nurse Gemma meets her match in mum-to-be Marilyn.
I got bitten on the nose. She is a little bit of a feisty madam, I'm not going to lie.
And you won't believe what this pet snake has swallowed.
Oh my God.
Come on, there's your girl.
Mobile vet Audrey is on her way to a special rescue centre that's become very close to her heart.
Possumwood is a wildlife sanctuary just outside of Canberra. It's in a town called Bungendore. It sits on a really beautiful hill and they really house kangaroos, wombats, possums, rehabilitate them, and just a safe area for wildlife to hang out and recover.
We're in prime kangaroo habitat in this area, and so many are either shot, chased by dogs or hit by cars. And so we felt that they were the animals that really needed our help most.
Audrey has been volunteering here every weekend since devastating bushfires in the region left hundreds of injured kangaroos struggling to survive.
Hi, Rosemary.
Oh, hi. Audrey,
Nice
didn't
to
see you come.
see you.
Thank you for coming again.
No, that's
looking forward
okay.
to another
We are
busy
looking
weekend.
forward to another busy weekend. How are all the girls going?
Oh, they're doing really well this
Yeah,
week, not
yeah.
compared to Audrey has been a godsend to us because she actually relates to the animals. You can see she loves animals. It has made our job so much easier because it's very difficult anyway, just looking after these animals, the amount of cleaning and care that we have to do. But the veterinary treatment would have been very problematic without Audrey.
Today's first patient is Hipster, a victim of fence hanging.
Hipster is a joey, a little kangaroo that we've been seeing for a couple of weeks now, and he got stuck in a fence with one of his legs, which is quite common. So what he was doing when he was trying to free himself is that he damaged the bottom of his foot. He actually fractured a toe, he severed a tendon, and he dislocated his hip. So we fixed the soft tissue injury, we actually amputated one of his toes, and we took him all the way down to Sydney to Northside Specialist Hospital to get a hip surgery done.
All right, ready for us to start? Beautiful. That was actually really exciting.
So far that's all gone really well. And today we're going to check that all out and see how it's healing. Oh, that swelling's gone down heaps. That's amazing.
Wow, that looks really good.
There's pretty much no swelling around the surgical site, which is amazing. And certainly today, Hipster is a lot more comfortable to just move that leg and manipulate that joint. Prognosis looks really, really good in terms of recovering faster than I expected. Finished looking at the surgical site. I'm happy with how that's going. So I moved down to his foot and we're having a look at the bandage there from the old surgical site. And I'm a little bit bummed. It actually doesn't look too great. So the area has actually opened up and the wound has actually started to get infected and the skin to die off. The injury from the fence and the barbed wire is so bad it can cut off the blood supply to that area of the foot. So even though we suture everything back together, we remove the broken bones, the wound starts to break down a couple of weeks later. So that's what's happening. So that wound is breaking down and on top of that we're getting that pus. So the main thing we're going to have to do here is just remove everything that's dead as much as we can, try and get rid of that pus and infection and then start him on good antibiotic control and then hope that we can get on top of that infection and it doesn't affect anything we've done up here because this guy's been through so much already. So hopefully that isn't going to set us back too much. So what I'm going to do now is just flush that wound and all that pus away with some saline. So the way we've been doing since the beginning with even the burn victims is just getting a saline bag, sterile saline bag, cutting a hole, and then just using it like a little washing machine flush and just shake. Shake it. just cut away all the dead tissue. Doesn't look great because it's got a gaping hole in the middle of it. But what we're going to do is try and get it to heal from the inside up. So it's called secondary granulation tissue. And then once that tissue fills in the defect, the skin should crawl across and close as long as we keep infection away. I'm confident he's going to pull through. I'm confident that that wound is going to heal, and then we're going to see him go home.
He's just waiting. Wait for the nice vet to come along and have a look at you. Okay, mate?
At the Bondi Clinic, Mel is anxious for Chris to check out his newly adopted mate, Benji.
Relax, Benji. It's okay, mate. It's okay. Benji is a rescue dog. I found him at an animal shelter and fell in love with him, and I decided to adopt him. At the time, they did advise me that he had a heart murmur that required further investigation. And I guess that's why I'm here.
Mel is already besotted with a 12-month-old Australian Silky Terrier and is desperate to make sure his little buddy is okay.
I've grown very attached to him. It's almost like a life-changing moment for me. I guess I've never had to have responsibility before my life, and caring for him and looking after him has been the best thing that's ever happened to me.
How you going?
Hi.
Is this Benji?
Yes.
Yeah, how are you?
Hi, I'm Mel. Nice to meet you.
Mel. Come on through.
Thank you.
Cute dog.
Yeah, he's a little angel, he is. Very naughty. Okay, buddy. He's nervous.
I know, he's so shaky.
Yeah.
How long have you had him for?
3 months.
Yeah.
Yeah. He's a rescue dog.
Yep.
And when I adopted him, the vet at the shelter said that he picked up a little heart murmur.
Okay. So, even though you were told he had a heart murmur, you still adopted him?
Yeah. Well, my heart went out to him. He was in a little cage with 2 other big Labradors. He was very scruffy, very unkempt, looked scared, and he just leapt out at me and put his paws up on the cage and said, "Please take me." And I couldn't say no.
It's one thing to take on a dog from an animal shelter and give it a second chance, but to take on a dog that has a heart murmur, a really quite serious medical condition, that shows a lot of faith and a lot of belief in the fact that you're going to be there for them. So what I'm doing there is I'm actually pressing on his gums. By doing that, what I do is I force all the blood out of the gum and then wait for his own circulation, so his own blood pressure to push it back in. For a normal dog, it takes between about 1 and 2 seconds. With Benji, I'm going to press. 1, 2, it's about 3.
Okay.
So
slow.
It's quite slow. What that's really telling me is that his circulation isn't really doing its job. It's not forcing the blood around the body to those places where it's needed, and that worries me. Are you seeing any other signs? I mean, is there anything day to day that you notice that you think isn't quite right?
Yeah, he gets overtired very easily, especially on hot days. He starts to almost wheeze, like he's not getting enough oxygen in his lungs. He actually cries, like he gets tears in his eyes. I've never known a dog to cry or anything like that. I just can tell now that he's in pain. It's almost like he had a heart attack a couple of times, Doctor. He just couldn't breathe, and his heart was just going like that. And I just sort of beat on the top here, and his blood started going. So he started breathing normally.
When Mel tells me that Benji has trouble breathing, he wheezes, he looks like he's going to collapse. They're all things that really worry me about this little dog. At 1 year of age, he should be running around madly, having the absolute time of his life. But he's not doing that, and that's a big concern. Okay. So I'm going to listen to his heart.
Okay, boo-boo, it's okay. Let Dr. Chris look after you.
I'll be honest, I'm almost nervous picking up my stethoscope to listen to Benji's chest. You can feel just how much Mel's invested emotionally in this little guy. A bit of bad news here, it could really crush him. Normal heart murmurs, they're very subtle. This one, it's screaming in my ears.
I'm looking at Chris and it's kind of scared me that he was taking so long. To me, that indicates that it might not be a normal heart murmur, that it could be something more severe.
He's a good boy.
I can almost feel it rather than hear it. It's such a palpable murmur. It's really strong, and it's not good news. It's a really big murmur there.
Oh.
So his heart, when it's beating, instead of it being really crisp and boom boom, it's a big loud whoosh boop, whoosh boop.
Okay.
So his heart's not able to pump the blood that his body needs because it's leaking all through it. I'm actually quite concerned about Benji. It's not like a heart condition that might pose a problem in a few years' time. This is an issue that could kill Benji any day. He's either got some sort of obstruction in his heart that's not allowing the blood to pump out properly, or he's got a hole in there, or some sort of leaky valve that's meaning that the heart is no longer an efficient pump. It's got leaks everywhere.
So it's pretty bad then?
Yeah. I don't like what I'm hearing.
Okay.
I think the best thing is that we organise for you to go up to SASH.
Okay.
And from there we can get a good look at that heart, understand what we're facing here.
Look, if it's a money thing, I'll do whatever it takes. I'll beg and borrow or whatever. I'll do it. I haven't got that much money, but whatever I've got, if you can help him. He's the best thing that's ever happened to me, and I don't want to let him go. I don't want to look after him.
Well, you're giving him every shot at that.
It's not really the news that I wanted to hear. Thinking about the pain that Benji's going through, a bit distressed and a little bit scared about what's going to happen moving forward.
We're together on this now, all right?
Thank you. Thank you, Doctor.
Okay, I don't feel like you've got to fight this by yourself.
Thank you.
Chris, how are you?
How are you? This is Mel.
G'day, Mel. How are you?
And Benji.
Good, thank
This
you.
is Benji. I've heard about Benji.
Benji, say hello.
Hello, mate. He says a bit scary.
Yeah.
Hey, what's up? You got eyes under there? There they are.
All right, come on in. We'll have a look.
Thank you.
Chris is so concerned about Benji's heart murmur, he's come along to SASH with owner Mel to see specialist surgeon Dr. Andrew Marchevsky.
Okay, let's have a listen.
Good boy. It's all right.
Yeah, Benj, that's a big murmur. Listening to Benji's heart, you're not getting the normal dup, 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 dup sound. It's really a shh sound. So the blood's, it's what we call a murmur, and the blood's not flowing how it should. Out of 6, which is how we grade murmurs, it's sort of 4 or 5. And generally when they're like that at this age, it means that we have to do something to fix it, or he'll have a short life. And that means, you've got a year, maybe, and it might not even be that long.
I knew, there could be bad news, but nothing that severe.
So I think the first thing we need to do is a heart ultrasound,
Okay.
so that we can find out exactly where all this problem starts, and then we can go from there. There are a number of things that could be going wrong with Benji's heart. He could have a hole in his heart. He could have a valve that's leaking. He could have a valve that's too narrow. None of them are good things. Some of them we can fix, some of them we can't, but we need to find out a bit more before we can tell.
So here we've got Benji's heart on the screen.
Specialist cardiologist Dr. Rita Singh is conducting the ultrasound.
My first impression is that we do have some moderate enlargement of the right atrium and some moderate thickening to the wall of the right ventricle. Everything we're seeing now is all consistent with pulmonic stenosis.
Pulmonic stenosis is a rare and extremely dangerous condition, which, if left untreated, can lead to sudden death.
So Rita, does he look like one of those dogs where something can be done surgically?
I think he looks like he'd be a really good candidate for the correctional procedure.
I guess all of this means that I've got to go and tell Mel that his dog needs surgery. It's not something we can ignore. It's not something we can give medicines to. His little dog's going to have surgery, and otherwise he'll die. It's not like open heart surgery. We can do a surgery where we put a catheter into a vein down in his leg, thread it all the way up into his heart, and then we use a balloon to pass across that valve that's narrowed. The balloon's deflated, and then we've got it across there, we blow it up, and it essentially tears open that narrowed area and allows blood to flow.
Given the information overload that Mel's had to experience today, I'd love to be able to say to him, you know what, mate, take some time out and think about it. But the situation with this heart condition is that it's not possible. With every day that goes by, Benji is damaging his heart more and more. He has to go into surgery, and he has to go in right now.
At SASH, life-saving surgery to repair Benji's heart is about to get underway.
Well, as usual, you're in charge and I'll just do what you tell me to do, so.
Okay, let's get in there.
Cardiologist Dr. Rita Singh will be performing the delicate procedure, working closely with specialist surgeon Dr. Andrew Marchevsky.
First thing we've got to do is pass a wire into his heart via his jugular vein.
That looks like it's going.
So can we just have a picture? There we go.
The guide wire is now in place. The next stage of the procedure will be even more delicate.
We've actually got to get a catheter into his heart, and this one's got a little balloon on the end of it.
The balloon will be used to force an opening in Benji's constricted heart valve.
Really fiddly, this part. Really hard.
Come on. There you go.
With the catheter now fully inserted,
Wait. Hang on a sec, just stop for a sec.
the surgery is at a critical stage.
The balloon now is sitting just over that narrow valve. It gets a little more risky when we actually start trying to blow it up.
All right, shall we just go? Yes. All right, go.
Ready?
Yep.
Here we go.
Away.
Here we go. There we go.
Okay.
Just perfect.
He's not happy.
At this point, Benji's life is hanging in the balance. The balloon has done its job making an opening in the valve, but the blood can't start flowing until the balloon is out.
The dog's not doing well. We need to move on, Andrew. Dog's not doing well. Which part do you want to do?
I'll pull the balloon out.
Okay.
You got the wire?
Yeah. Just go
The team has just seconds to get the balloon out so Benji's heart can recover.
All right, pull out. I'm pulling it back too, so. All right, we're good. Keep going, you keep going. It's out of the pulmonary artery. Okay.
There you go. All right, we're done here.
The delicate surgery is over and Benji is out of danger.
Basically, Benji's outcome could not have been any better. We've just put a balloon across his valve, opened it up, and now his heart's basically pumping like a normal one. It really can't be any better than that. Hey, Benj. You coming out? You coming out?
At SASH, it's been just 24 hours since the intricate surgery to fix little Benji's heart murmur.
You're looking far too relaxed in there. And the great thing about what we've done is we've done an amazing thing for his heart, but done it totally non-invasively. So he's got a little nick in his vein there, and yet he's right to go home.
For owner Mel, it's been an emotional ordeal, and he's anxious to be reunited with his brave little mate.
I'm really excited to see him. What they say is true, you know, a dog is a man's best friend. And he really is my best little buddy, and I can't wait to see him.
Who's that? I know. Yeah. Oh no, but there you go, boy. Oh, Bill, goodness me.
I'm sorry, I left you for a couple of days, didn't I, buddy? I feel like a big load or a pressure has been lifted off my shoulders. And just to have him back, I feel so happy. It's just so happy. Benji, yeah, Benji. Come here, buddy.
When I first met Benji, he was a quiet, just reserved little dog, and he just didn't look happy. But you see him now, and he's bouncing around and just being a crazy puppy. So I think we've made a big difference to him.
Hey, buddy. We're going to go home now. We're going home. Benji, go home. Yeah. Go. There you go, mate. Go play.
As for brave little Benji, it's been 8 weeks since the operation to repair his heart.
Go, mate.
No way.
Come on.
I'm seeing it. I'm not sure I'm believing it though. I expected a change with Benji, an improvement, hopefully, but I didn't expect this. I just saw more in 50 metres than I saw before at all.
Oh, Chris, it's amazing. The difference in him is amazing. He would have never have done that sprint ever before.
That run there, it's better than any stethoscope, any ultrasound, because that shows you that not only is he healthy, but he's happy as well.
I can't describe to you in words how happy I feel just seeing him being himself, or being this Benji that I never knew was there before. To see him happy, I feel good inside myself. You know, it's been a journey, and the outcome it's been special. This has gone beyond my wildest expectations.
Yeah.
I could spend the next 15 years hanging out with him and chilling out and doing all the things that we do.
Yeah.
And it's great. It's really great. Thank you. Thank you so much.
No worries, mate. Thank you, Nathan.
Cheers, mate.
Monty's 18 years old. I've had her for 16 years. She's family. She's got her own mind and her own mindset, and let her out for a few hours as I cleaned the house. Got home and daughter's like, "Where's my towel, Dad?" I had a tug of war for nearly about 40 minutes trying to get it off. I had the door slightly jarred so I could just get the towel out, so I didn't want to get her out. And I pretty much was prying it off her clutches until she decided she wanted the towel a little bit more than what I did. She swallowed it, towel.
I myself have never treated a snake that's ingested a towel before. Sometimes they'll eat like their feeding tongs or something else that might be left in their cage near their feeding item, but definitely not a beach towel. Just hold that together. Because Monty is quite an old snake, we really wanted to do the most conservative treatment possible. We wanted to avoid a surgical procedure. So endoscopy is a procedure where we use an instrument with a camera on the end, and it can be used to go inside of body cavities. It means that we can anaesthetise the patient, put the camera down through the gut, and then use forceps with the endoscopy to retrieve that towel. It definitely is one of the weirdest procedures I've done.
Yeah, it was a long 5.5 hours to get the phone call. I was actually with my nephew, and to get the phone call saying that she'd actually pulled the towel out without surgery, I thought was just an amazing thing for her to go through.
It was actually a lot of hard work. It was very laborious. It doesn't look like it's that hard in the video, but we were using a lot of effort and muscle power. I did say to her, "You can't be eating any more beach towels. We don't want to see you back here."
Yeah, very lucky, yeah. Extremely lucky, I think. Very lucky.
Over in Greenford, Scott's new vet Joe and vet nurse Gemma are on a house call, bringing an abandoned mother-to-be to a good Samaritan.
Come on then, Marilyn. Let's go meet Penny. Penny's going to be taking on Marilyn, and Marilyn's a stray cat who unfortunately has got herself pregnant. Naughty girl. Hey,
Hi, Penny.
Hi, come on in.
This is Marilyn.
Yeah.
She's got a name.
Yeah.
Penny is a very good old family friend of mine, and she absolutely loves cats. Not many people I know would take on a stray cat, let alone one that's pregnant, to have the kittens in their house.
Come on in. Right, where are we going to put her? Shall I move this across?
Yeah.
I really enjoy it. It's a lovely experience watching them grow and then have the kittens, and you know they're going to go to good homes because the vets will make sure of that. No, so it's really worthwhile doing, I think.
Maybe
There
she
we
can
go.
hang out on there. What Penny's doing is amazing. This is going to obviously turn Penny's life a bit upside down for the next couple of months. It's a lot to take on, so it's really fantastic that she's willing to do that for us.
Where did you find Marilyn?
She was found in Chiswick, and the person who found her thought it was their cat who they lost. And then they realised it wasn't their cat when she started hissing at them.
That's terrible.
And then they got a photo and they realised it wasn't the same cat.
Oh my goodness, that's so bad.
Poor
That's
old
so
Marilyn.
bad. Poor Marilyn.
The plan today is for Joe and Gemma to ultrasound Marilyn and check on the health of her unborn babies.
Should I start setting it up?
Yeah, if you set her up, and then Penny and I will let her out.
It should be a simple procedure, but Marilyn already has a reputation.
She is a little bit of a feisty madam, I'm not going to lie. She can scratch and bite.
I'll try and hold her, or do you want to hold her? With the expert. Yeah, oops, there we go.
I don't think it's going to be an easy task.
Oh, naughty
on the nose.
baby. Oh.
Is it bleeding?
No.
I always get told not to put my face so close to the patients, but I like to try and comfort them. All right, young lady. I was trying to wipe my nose. Now I learned my lesson, why I shouldn't put my face close to them. Because you get your nose bit. Have a little wonder. She's just nervous and she's probably protecting her babies. Maybe she's feeling maternal.
I don't mind.
Maybe if you rock her back on your lap.
Oh, there we go, sweet pea.
After a short break to regroup, Joe and Gemma are trying once again to get Marilyn ready for her ultrasound.
It's all right, baby.
With a half-shaved
It's all right.
and fully cranky cat,
All right, shush, shush, shush. Calm.
this mission is a long way from completion.
We're really struggling to shave her tummy without her taking chunks of flesh off her. We're going to have a look at your babies, Marilyn.
Right now, the feisty Marilyn is taking no prisoners.
Has she given you a war wound?
It's only a little one, but there is blood.
Oh, so she's breaking the skin now.
So what do we turn to when this is happening? It's our secret weapon, treats.
Good girl, Marilyn. Come on, sweetie.
Let me think about the treats. I haven't done this with a patient before. Well, not a cat anyway, maybe a dog.
Oh.
That's looking good, Gemma.
Working. So we managed to shave her tummy in preparation for the scan. However, it did take quite a lot of treats, but it needs must, and in some instances, it's just what you have to do.
You got to do what you got to
Yeah,
do.
absolutely.
You enjoy that, Marilyn.
Come on, have some more,
That's
please.
the only time you're having a whole box in one sitting. Good girl.
Good girl, Marilyn.
Have I set it up okay? Is it working? Ooh, you're about to bite me.
So the scan is really difficult to do because Marilyn is having none of it and she does not want us to scan her babies.
It's a good girl. Ooh.
Yes, definitely.
Marilyn's determined not to make it easy.
Regular.
Okay, I'm just going to turn the light off so I can see the screen properly.
But Joe can finally detect some movement.
So, there's a heart. Let me just get a quick heart rate from kitten.
You can't tell how many there are at this stage, can you?
What I can see is she's definitely having more than one kitten. I can see them back to back in a view, two spines right next to each other, and they're moving around, so they're nice, healthy kittens.
You're going to be a mummy. You're going to be a good mummy, aren't you? Because you're going to protect them with that feisty spirit.
I am delighted that she's having more than one or two kittens. The more the merrier, as far as I'm concerned.
Okay, so I can see. Oh,
right. Oh! Did you you get everything you needed to see on there? Because she broke my watch and took my badge off.
I feel sorry for Marilyn that she's astray at this time of her life. She's obviously quite a young cat. It's sad for her that she has to be fostered to have her kittens, but she's pretty lucky in the fact that she is now going to get a lovely new home and her kittens will find amazing homes.
Lovely to meet you, Penny. Take care. Bye, little one.
You'll see her soon, I'm
I
sure.
will. Maybe next time I see her, she'll have her babies.
Hopefully she'll have her babies, yes.
Can't wait to see them.
Oh dear. Good girl, Marilyn. It's all right. I think I do have a bit of an affinity with cats. I really enjoy them. I really do. Even the naughty ones. Well, sometimes especially the naughty ones. All right, baby. It's just you and me for now. You gonna be a good girl? Hi! Hello! Hello, Gemma. I was just about to get the kittens out.
Oh my God, they're so cute. I want to cuddle.
Oh, you better have one.
3 weeks later, Joe and Gemma are back at Penny's to check on Marilyn's new arrivals.
Pass them up. Hi. Hello. Oh my God, these kittens are so cute. They're just too adorable. I want to take them all home with me. Hello, babies. Oh, don't stand on your sister's head. So last time I saw Marilyn, she bit me on the nose, but this time she has been a model mum. She's been really, really lovely with her kittens, cleaning them and letting them feed from her. So she's been really great today, much calmer.
Nice strong heartbeat.
Good.
Can't hear any murmurs and the rhythm sounds good.
What are we doing to your baby, Marilyn?
It's all right.
Now her 3 boys and 1 little girl all need names.
You're called Lulu.
You like Lulu?
Yeah, okay, I like Lulu.
And then this is Bob.
Right.
And this is Bert.
Oh dear.
And this is Alfonso.
No. No, that's no Alfonso.
We need a cute name for a little animal.
This is a Tim.
A Tim.
A Tim.
Oh, Bert.
Lulu, Bob, Bert, and Tim.
I always find it really difficult to say goodbye to the kittens and the mums usually, but I know they're going to good homes and that's the main thing. I think it's very important that people do foster. There are so many creatures out there, you know, somebody's got to do it. I'm really proud to be able to do it. Oh, good girl.